My name is Abe Scar. I'm the director of Illinois PERG and the Illinois PERG Education Fund. I'm here today with Dr. Samir Patel, who is a doctor at Lurie Children's Hospital, and we're going to talk about antibiotic resistance. So can you briefly explain what antibiotic resistance is?
Sure. Antibiotic resistance is a situation that develops when the organisms that you're treating with antibiotics develop resistance to that drug over time. So for example, if you expose bacteria to a given antibiotic like penicillin, because they're living organisms, they can adapt, they can mutate, and over time you will see those organisms be no longer treated by the antibiotic. That can happen in many different clinical contexts. Those organisms can spread to other people, so then resistance can be an issue that affects not just the initial person, but other people in the community. Antibiotic resistance is one of the greatest threats to public health, as recognized by the Centers for Disease Control and Prevention, the World Health Organization, and multiple medical societies. Since the advent of antibiotics in the beginning of the 20th century, they've been integral to modern medicine, but they're losing their effectiveness over time. So a lot of both routine and serious infections that we rely on antibiotics to treat children and adults will no longer work. So we're facing a situation where in a few years and a few decades that a lot of infections that we currently can treat will become deadly.
And what are some of the biggest drivers of antibiotic resistance? Why are we seeing more antibiotic resistant bacteria?
Well, the single greatest driver of antibiotic resistance is overuse. So the more we use antibiotics, unfortunately, the less effective they become. So that's why we view antibiotics as a precious resource. Every situation, whether it's in clinical medicine or outside in food production, we really need to use antibiotics as a precious resource.
You just mentioned food production, and that's a big concern of ours. One thing that most people don't know is that the vast majority of antibiotics important to human health in the United States are used in animal agriculture. 70% of all antibiotics sold in the United States are sold for the use on farms. What do you think of this practice, and how is it impacting antibiotic resistance?
So in human medicine, we recommend that antibiotics not be used routinely, not be used in a knee-jerk fashion, and every use of antibiotics should be justified. Similarly, especially in agriculture where so much antibiotic use, the bulk of antibiotic use is, that we would also expect that basic level of judiciousness with antibiotics, where we give antibiotics only to treat sick animals, but not to use it routinely, because the exact same principles that lead to resistance in humans leads to resistance in animals, which can spread to humans.
What can the public do if they're concerned about antibiotic resistance?
The public can do a lot to make sure antibiotics are used judiciously. First, as advocates and citizens, we can let our legislators know that we should demand that antibiotics are used as a precious resource and are not overused. Number two, as consumers, we can exercise our options and purchase meat that was raised without antibiotics, or meat from restaurants that was raised without antibiotics, so that there's economic pressures as patients and family members of the patients, and as consumers and advocates, we can make a difference in how we talk about antibiotics, how we use antibiotics, and how we consume meat, and that we should exercise our judgment.
Thank you very much.